Nicole, and I'm going to be your nurse today. How are you?
Good, how are you?
I'm good. Today we're going to be performing a head-to-toe assessment. It's going to take roughly 15 minutes. Okay, so I'm going to close the door for privacy, wash my hands. I'm going to lift the bed up to a working position. Can I see your wristband? Can you state your name and date of birth for me?
Adriana Flores, 04/14/2001.
All right, thank you. Ms. Flores, do you know where you are today?
Yes.
Where are you?
In the hospital.
Do you know why you're here?
Yes, for a head-to-toe assessment.
Alrighty, and do you know what year it is?
2024.
Alrighty, patient is alert and oriented ×4. From initial inspection, I can tell she is clean, well-groomed. Her hygiene is up to par. She's dressed nicely. She is on room air and her breaths are not labored. Her speech is clear and understandable. So I did raise the bed up. If you want to swing your legs over so I can inspect your head. Patient's head is round. There is no masses. It's symmetrical and her hair is evenly distributed. Going to check her ears and her nose for any redness or drainage. Look up for me. All right, her ears and nose have no redness and no drainage. Her sclera is china white and her conjunctiva is pink. All right, and now I'm going to, I'm so sorry. I'm going to check your pupil size. All right, before light, pupil is a 5 millimeter bilaterally. All right, after light, pupil constricted down to a 3 millimeter. Her lips are appropriate color for ethnicity. She has all her teeth. Alrighty, and if you could look at the tip of my pen light, we're going to assess the 6 cardinal positions of gaze. So just look at the tip of the pen light and just move your eyes. Alrighty, one more. All right, and if you can just find a spot above my shoulder. If you can look at my pen light for me. Alrighty, so pupils are equally round, reactive to light and accommodation. Her skin on her face is appropriate for ethnicity. Now I'm just going to feel your neck. No noticeable lumps. Now I'm going to take the carotid pulse. Carotid pulse is 2+ bilaterally, regular rate and rhythm. Now, if you can do me a favor, Ms. Flores, and tilt your head back a little bit, about a 45-degree angle. I'm going to move your hair just a little bit. All right, thank you. Patient does not have jugular vein distension. All right, now we're going to move down to your arms. Patient's skin feels warm and dry. Patient has no turgor. Now we're going to feel your brachial pulse. If you can just turn your arms around for me like that, thank you. Alrighty, brachial pulse is 2+ bilaterally, regular rate and rhythm. Now the radial pulse. 2+ bilaterally, regular rate and rhythm. And now I'm going to check her bony prominences. Alright, there's no skin breakdown. I'm going to check your capillary refill. Capillary refill is less than 3 seconds bilaterally. Now, Ms. Flores, if you can grab onto my fingers and squeeze. Alrighty, grip strength is a grade 5 bilaterally. Now if you can put your hands like this for me. And when I push down, push up. All right. And when I push up, push down. All right. Muscle strength for upper extremities is a grade 5. Miss Flores, if I could have you lay down for me. All right. I'm going to listen to your heart. And if it takes a little bit, that doesn't mean anything's wrong. I'm just trying to make sure I get all the locations of your heart. I'm going to use the diaphragm of the stethoscope. And this is the aortic spot. It is second intercostal, right sternal border. All right. Pulmonic spot, second intercostal, left sternal border. Erb's point, third intercostal, left sternal border. Tricuspid spot, fourth intercostal, left sternal border. Mitral spot, it is the fifth intercostal, mid-clavicular line. And this is where I'm going to take my apical pulse. All right, just stay right there, Miss Flores. Patient's apical pulse, regular rate and rhythm, it was 75 beats per minute, and then patient's respiratory rate was 16. All right, and if you just stay there, I'm going to now auscultate your abdomen. Patient has normal active bowel sounds in all 4 abdominal quadrants. And now I'm going to palpate your abdomen, and if you have any pain, just let me know. Patient noted no pain from palpation, and there was no masses. All right, Ms. Flores, if you can please sit up so I can listen to your lungs. I'm going to listen to the interior side of your body first. All right, are you ready?
Mm-hmm.
Okay. Okay, patient's lungs interiorly are clear to auscultation and no adventition sides. Now I'm going to go around and listen to her lungs posteriorly. All right, posteriorly, patient's lungs are clear to auscultation, no adventition side, so all 5 lobes of the lungs are clear. Alrighty, and then I'm just going to look at her back for any skin breakdown. All right, her skin looks intact, no breakdown. All right, Ms. Flores, I'm just going to look at your legs now. Patient's legs are warm and dry to the touch. Her skin is appropriate for ethnicity. All right, and I'm going to feel her posterior tibialis pulse. Her tibialis, or posterior tibialis pulse is 2+ bilaterally, regular rate and rhythm. Now, Ms. Flores, I'm going to take off your socks real quick. I'm going to feel your dorsalis pedis. Patient's dorsalis pedis is 2+ bilaterally, regular rate and rhythm. And now I'm going to check your capillary refill. Okay. All right, capillary refill on patient's feet bilaterally is less than 3 seconds. And then I'm just going to check your heels and your ankles. Alrighty, patient's bony prominences are good. There's no skin breakdown. All right, and if you could just lay down for me one more time, I'm so sorry. Going to check for pitting edema. All right, patient does not have pitting edema. Alrighty, now when I push up, if you can push against my hands, okay? And when I push down, if you can push up. All right, patient's lower extremities, muscle strength is a grade 5. Patient has no tubes, lines, or drains attached to her. I am going to lower the bed, put the side rails up, lock the wheels, give patient the call light. Do you need anything else from me, Ms. Flores?
Oh man.
No, you do not? Okay. Going to wash my hands and exit.